welcome to this interview. Thank you for accepting and coming to talk with me about climate change, global health, and technology. First, I want to make like a brief introduction about you so that the audience watching the interview can get to know you a bit. Okay. Lukas is a physician. He's based in Berlin. He co-founded UNIFEC for Health, a platform for people whose purpose is to promote health, international solidarity, and peace. The base of this platform is to contribute to sustainable development goals, enhancing access to quality healthcare services and safe medicine for all. Also, as a part of his postdoctoral activities, Lucas has a podcast to support the education of medical students in work conditions. Now, Lucas, could you share a bit about your background experience with global health, climate change, or technology? And how did you get started and how was your journey evolved in these topics?
Yes, thank you very much, Karen. Thanks for the introduction. Yes, I'm Lukas Herrmann. I am originally from Cologne, western part from Germany, and I graduated from Frankfurt University in 2018 as a medical doctor. And during my clinical studies, I completed an extra curriculum on global health at the university in Gießen, where I also co-founded Unified for Health. And today we are a community of students and young professionals of the medical fields in general. And we organize so-called public health exchanges for global learning. But we are also equally enthusiastic about any formats to facilitate multi-national knowledge and experience exchange. So it's really about learning and exchanging ideas at Unified for Health. Additionally, I had the chance to work at the World Health Organization in Geneva as an intern in the Department of Universal Health Coverage. And here I focused on a project so-called Twinning Partnerships for Health. And the program facilitates hospital partnership programs between different clinics worldwide, basically. And during my practical year, final year of studies, I supported an ongoing exchange between the Kenyatta National Hospital in Nairobi and the University Clinic in Frankfurt. And last but not least, in 2023, I joined the Institute for Research in International Assistance at Akron University to support a podcast for training and medical education, as well as professional exchange. And the initiative aims to support healthcare professionals in Ukraine during times of war. And podcasts on a variety of topics are designed to basically support medical, but also nursing staff, because they face common clinical challenges. And because since the Russian invasion, the current burden on the Ukrainian healthcare system has increased so much that there's also a need of basically content on very big variety of topics including emergency medicine, mental health, rehabilitation, but also planetary health and climate change, as these are topics that are increasingly getting attention and are urgent to address. So yeah, that's a bit of my background for now. Back to you.
Okay, thanks. It was really nice to know more about your background. Now, I want to go more deeper in the topic, and maybe you can give me your opinion about why should people care about the topic of climate and health. This taking in account that this climate change represent like a real health risk, right? The health outcomes we can receive about the climate change, like the air pollution, I don't know, the increasing of the temperatures that maybe can impact the health system and facilities. And I want to know why the people should people care about this.
Great question. I believe I would go with the World Health Organization stating that climate change, in fact, is the biggest health threat of the 21st century, affecting basically every one of us. So it's really the biggest health challenge. And when it comes to health, planetary health in particular, it is so important that we need a healthy planet, healthy people, and we are currently destroying our livelihood. We, as humans, really depend on the biosphere, but how we are treating ourselves, but also our biosphere at the moment is incredible. And even if attention is increasingly getting more, there's still not enough action. And yeah, that's why we at Unified for Health believe we need to also really put attention and focus on the topic. That's why I'm happy we get to discuss more in detail. Yeah, so basically, and I can only refer also to the 2023 report of the Lancet Countdown on Health and Climate Change, where we get lots of inspiration for each of us at Unified for Health. And so in a nutshell, that is why we believe, and I believe it's important to care about the topic.
Yeah, I don't know, but currently, was some people think like the climate change and the health don't have like any connection. But in the course we listen, like I want the chat, and they say something like we can be expect to be healthy if we are in a sick planet. And when I listened that sentence, it was like a really shock, right? Because some people don't think that is so big, like all the connection we have between this. And some things like the people of they don't consider sometimes is, for example, the medical service. Sometimes they have like a really quantity of waste, right? Because all the attention we have to do to the patient, like okay, we need to be to provide the security of the patient, but we then the medical care, you have like a lot of waste. And maybe if this is something we can be focused right now, no, to try to use the technologies or the things to develop. And we found or we studied one specific way, and was in our in a laboratory, like when you go to take an exam, something like that, they take like a lot of examples of blood of you in different. And this laboratory like develop a system like they with only sample of blood, they can make different testing for you. And that was like really awesome, because they the goal finish was like they reduce the number of the sample they had to take and the waste. And that's just like a really good idea to improve in this case the health and help the climate change.
Absolutely. So really an important point that you're raising there, as the medical sector itself, so speaking of all the hospitals and healthcare, contributes a big bunch of let's say the CO2 that's being produced, not only because of the gases, but also, as you said, the material. And even today, I spoke to a really inspiring nurse, a colleague in the department where I work at the moment, and she's really motivated to change, because also here in my daily practice, I face the situation that so much waste is being produced as we use only one-use products, because it's cheaper to use them instead of cleaning them or instead of having reusable equipment. But it's often cheaper to get new equipment. And a big bunch or a big part of it is plastic. So we use so much plastic, and we really actually just spoke about it today. are trying to find ways to reduce the plastic use at the hospital.
Oh, thank you for your opinion. Now to go like a little deeper into the topic. The rising temperatures, the more extreme weather events, increasing the air pollution and decrease the water or food security. This is like the climate change effects. I already impact like a population in the world, but some specific communities like they have more risk than another. And what do you think is like the role the technology plays in the intersection between climate change and global health? Because some people consider like the technology has the potential to be transformative, a force that help maybe to the mitigation of the effects of the climate change on global health, of reducing emission or and the waste from the health, like I mentioned before to you. For example, we took some example like in some places they have this they are doing like this transformation of this chain, this switching from the normal energy to more cleaning energies in some hospital, and maybe they can help, for example, in an emergency situation. What do you think about this?
Yeah, so first, to the first part of the question, really to see if technology can be the key component on the way towards preventing or having, preventing climate change in that way. I would say I do believe that there's a good point that we do need technological innovations and tools. However, on the first place, I still think that we are in the time zone and an area that knowledge and the implementation of the knowledge just itself is still a key issue, because even in my daily practice, I meet still so many people that they are aware of climate change. However, they don't see it as the threat that it really is to many of us, but not to all of us. So I believe still knowledge transfer and then implementation of the knowledge is a key component. Um, and that also connects to imagination challenges. So we day to day we face news where we are confronted with new extreme weather events, and also the consequences of these weather events. But still, in my daily practice, I at least face too many people that do not imagine the challenges that will arise from this biggest health threat from the 21st century. So this just as a first answer to the question. However, I do agree also that technological or digital interventions do have a great effect. If we, for instance, speak of effectiveness and using smart systems for remote areas or regions that are really hard to reach, then we can think of technological or innovations such as drones that can, for example, transport essential drugs or vaccines to remote areas. We didn't have that before. And now, if we imagine that our post system somehow will be changed from being a driven car that is not even electric, change into a drone that is flying to our places, I believe that's an imagination that can be in place and is already being used for remote areas. So that's one point. And I also believe that technology really makes networking and knowledge exchange way easier. So, for instance, if we have warning apps to warn the population during extremely hot periods, or in case of extensive air pollution, or any other immense extreme weather events, these warning apps or these communication tools can be very helpful. and can save lives basically. So I believe it's a mix of many things, just to name a few technological innovations, but also really the knowledge and the implementation that is still needed to progress and to get closer to the goal of preventing climate change. Yeah, I'll leave it to that.
Thank you, thank you. I really think we have like we are in the same page because I know we have like all these possibilities with the technology, but the most important thing is like the good application of this, right? Like someone like we have in our classes, he say like the first principle had to be like first do no harm, because if you continue like acting and acting, because I'm progressing, I advances with technology, but what happened if this is good for the planet or this is not good for the planet? And we have like a lot of people involved in this technology thing, or in this technology field, like they're thinking like the same way. What happened with the technology is against with the climate, it's against with the health, it's against. We have to think really, really what is the purpose of doing this advance in the technology.
For sure. Yeah,
Thank,
absolutely.
thank you. Now, I have this question for you. Is what technology or digital intervention are you using to do your work? I know that right now you are in the field like telehealth, because are you look with the thing are you doing with the podcast? And but I don't know if you have in touch with telemedicine, renewable energy, or the AI. And if I want to know maybe if have you found them is to be effective?
Yeah. So as I mentioned, I work as a medical doctor. At the moment, I work in the intensive care unit. There, I'm treating patients with internal diseases, basically. So that's the at the moment the biggest chunk of my daily work. Um, and here I would say, first of all, it's still communications tools, so digital interventions, I'd say. So the hospital communication system is a key aspect. We are still in the progress of developing a fully digitalized hospital. We're still not there yet. So there's still a long way to go. So that's something to focus on, because I believe digital documentation in patient contact is safer, faster, and more on point, because doctors' handwriting, but also just having papers is something that soon, I believe, will belong to the history. However, I still mean it's important to have papers, but to have more and more digital technologies is important. So back to communication tools, we at Unified for Health also use the most common digital communication tools. So Trello, which is sort of Slack. I'm not sure if you're aware. Slack is more international. Trello is something really, I believe, German. It's just a community platform where we can. It's like an email tool, but a bit more organized. Then, of course, social media, WhatsApp, but also WordPress to use as an internet source. These are things that are quite effective and good digital tools. And if I dare to have an outlook to the future, I can only comment of what's in the pipeline in a bit, that I believe will change our daily practice also as medical doctors working in patient care. Because for instance, for artificial intelligence, people, friends and colleagues in Berlin are working on a app that aims at seeing or expecting somebody who has, for instance, COPD, and if they're soon to exacerbate, so if they have an prolonged, or if they have an exacerbation of their COPD, then the artificial intelligence tries to use the voice and the voice of many, many thousands of patients to detect if a patient is soon to have an exacerbation. So that's something I believe is quite interesting. They also try to do it with heart insufficiency. So I believe in the field of artificial intelligence, there's lots in the pipeline, and I believe in the next decade or 2 decades, there will be great changes also to medical care due to digital and technological interventions. Not fully there yet, so I can confirm that at the moment, in my daily practice, I use the hospital communication information system. That's the computer-based systems, but more than that, we're still progressing slowly. So I believe we can learn from different sectors, from other sectors, especially the sector in global health, and learn and take lessons to improve our patient or daily patient care.
Thank you. And now I want to mention like a little example we reviewed in the course. It was like in Africa. I don't remember exactly what country, but it's like a country they don't have good access to the medical care. In specific, it is for pregnant women, but they like do the control, the pregnancy control through a calls. And she can call to the doctor, talk with him, and only is if it's an emergency, she had to go to the more center, the hospital center more near to her. But this is so good for her because she say she lives so far away, like I don't know, maybe one day walking to this center hospital, and she say it's like awesome for her because she have all the information in his phone and she don't have to walk and go back, and it's like a good idea, like a good strategy, this part of the telemedicine. But I want to ask you maybe how was the experience in the pandemic moment? If you use the telemedicine, how do you feel with this? You think this work or no? Or what do you think about this kind of use of the technology?
Yeah, I believe it will definitely have a big impact, and it will be used more and more. Especially the pandemic has been a big driver of the telemedicine movement, and I believe also for basically primary healthcare, it will be an essential tool. So right now there is many telemedicine offerings around. In intensive care units, it's nothing that I use in my daily practice, but for primary healthcare, also um, um, at the let's say the entity that I'm working for, it's actually Europe's largest healthcare provider. They are already having a large chunk or a large part of telemedicine being offered, but that's mainly in primary care. And I believe, yes, there's great potential and it will be used more often. However, this will only be a part. So I believe for clinical medicine, especially in hospitals, still the patient contact and to see the patient, to feel the patient, to see the skin, to touch the skin, see how the volume status of the patient is so essential. So I believe it will never replace it, but telemedicine will be a good add-on for certain, especially primary healthcare questions. Yes, basically, that's my stake and my experiences for now.
Okay, thank you, Lucas. And right now, I want to know what worries you the most about the future of the climate and the health.
Yeah, so as a young father, I can say that every child born today will be affected by climate change. And actually, that's from the 2019 report of the Lancet Countdown on Health and Climate Change, ensuring that the health of a child born today is not defined by a changing climate. So that, yeah, so the goal, but saying that every child born today will be affected by climate change is a big driver, and that worries me as a young father. And but also not only that, from a very personal perspective, but climate change is also aggravating existing inequalities around the globe. So, so climate justice is also something that that worries me, because those affected by climate change will and are often those that are not the ones contributing to climate change as much or in comparison to others. So climate justice is something that worries me, and that is something we need to focus on. And as you said earlier, mean temperatures around the globe, including the oceans, break records year after year. And climate change is real, and it's happening right now. And there's still too much ignorance about the issue. So, um, as mentioned earlier, I think it's really, it's already past time. It's already past time to focus on it and to try to be um, more active and to try to advocate more and to try to live up to it. It's not easy. So also including me in my daily practice, I hesitate, I have challenges, but it's something that we need to focus on, and that will be an important aspect of our lives in the next 20 and 30 years.
Thank you. And finally, if because we are running out of time, maybe you can give us a little advice for the people is just starting to learn about climate change, global health, and technology.
Yes. So I would not call it my own ideas or my own experiences in that field because it's in a field where many smart and even smarter people made great contributions. So my advice for now would be to deep dive into literature to learn more, and I can suggest the book Planetary Health, Protecting Nature to Protect Ourselves by Myers and Frumkin. Happy to share that link again, but that's a book I can highly recommend. And it's a German initiative. It's called Planetary Health Academy. I can definitely advise and recommend the video material from that academy. It's also in English. They have extensive lectures being recorded, and they have fantastic topics in English and German. And that's something I can highly recommend to everybody who's just starting to learn about this field.
Thank you, Lucas. I was so glad if you shared that book with me.
Sure, happy to do.
Yes, I want to express my sincere gratitude for taking the time to participate in this interview related to the global health, climate change, and technology. Your perspective and knowledge have been extremely valuable on the broadening my perspective in this field. And thank you so much.
Most welcome. Pleasure is on my side. Thanks for reaching out and for having this great discussion. Thank you.